This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome to the program. Dave Wilson and Sarah Giosi with you this morning. And joining us in studio is Dr. Shane Prettyman, OBGYN and Medical Director of Mon Health Medical Center, Women's Health Services. Good morning.
Good morning. How are you?
Well, let me try that again with the microphone on. Good morning.
Good morning. How are you?
I'm doing well. How was, did you have a good holiday season?
It was good. It was very good.
Now,
yes.
I warned people last week, Sarah.
Yes.
Today's the day. You settle in.
You're back in action.
Because summer vacation's a long way away. Mm-hmm. So just settle in and get into that routine.
Yeah.
Are you settled back in the
Yes,
routine?
we are. Ready to roll.
Well, you kind of don't get to ever take time off, right? Because babies don't just quit coming.
You're right. And it never stops.
They don't recognize weekends or holidays or...
So inconsiderate.
Speaking of babies, if you don't know already, we are going to be talking about women's health today. OBGYN, Shane Prettyman joining us in studio. And you know what, Sarah? I might just defer to you for most of this program.
Yeah.
Since you're working on number 2 over there, you seem to be an expert at this.
I wouldn't go that far. But sure.
Well, let me start off with this question. Focusing on women's health care here in Morgantown, the mergers with Mon Health and what's going on here in town. Explain the mergers, what happened there, and how that's a benefit to patients here in the community.
Sure. So, we could talk all day about this, and I guess we only have a half hour, but we'll try to be concise. So, Women's Health Care of Morgantown has been a private OBGYN practice established for probably close to 30 years in Morgantown. Well-known, large volume, probably, in the last number of years, has had about 50% of the volume at Mon General Hospital. We've always been affiliated with Mon General Hospital. But over the last number of years, Mon General started their own OBGYN practice, and you essentially had 2 different OBGYN practices at Mon General, Mon Women's Health and Women's Health Care. And essentially they were competing against each other. May not have been the smartest thing to do, but they were competing against each other. And, with medicine and, this day and age, a lot of private practices are joining hospitals, being owned and managed by hospitals for lots of various reasons, whether it's in essentially the economics and the business of medicine, which is very complex, and I don't pretend to be an expert on it at all, but being in private practice, we got to see firsthand the business of medicine, and it's tough, from reimbursement rates to just your costs of doing business is really, really tough. Then when you're trying to recruit and bring on new doctors and providers, it creates tough things. And there's a lot of advantages with aligning with a hospital system and truly them being managed and owned by a hospital system that is benefit for the practice, but then also for the patients. So that's where it was probably a 2 to 3 year decision-making process on, do we try to continue staying a private practice versus being a hospital-owned practice? And ultimately, in this past year, decided being a hospital-owned practice would be the best thing for us. And that's when we really started, talking with Mon General a whole lot more.
And what are some ways that by completing this merger, the community is going to be better served? Yeah,
so, again, Women's Health Care had always been affiliated with Mon General Hospital, but you also had another great group of physicians that already worked at Mon General Hospital. So you had, and I truly think, when you say, how can this benefit, the patients, I really do think that it will. I mean, we were talking a little bit earlier. I remember 5 years ago, I was on this radio show when Mon General's birth center had just done an expansion and renovation. And it was really exciting. It was a big talk, and we saw a big increase in volume at Mon General. And that volume has sustained over the last number of years. And I really think that this is the next big step for OBGYN at Mon General as far as something new, something to talk about, where you really have 2 great, powers coming together, be it, Mon General Hospital, and their providers in women's health care. So I think it really, truly is going to be good for the patients. You have, a lot of patients who may have been established in Morgantown and the surrounding areas for a long time. They've had babies before. They've had friends that have had babies, and they've known the name Women's Health Care. That name's been out there for a very, very long time. But you have a lot of other people who may not have that history and those connections and not know, and they're newly pregnant or coming into town and they need some GYN services, and they know there's 2 hospital systems. You have, WVU and you have Mon General, both great places. But a lot of people specifically with OBGYN care like the private aspect of a community hospital, and they search Mon General Hospital, OBGYN, and you end up finding the Mon General employed physicians. And if you don't know, there's a whole nother group of physicians out there that you may have a harder time finding. So I think by having essentially all of the OBGYN practices under one practice, I think there's a lot more accessibility for patients. And I think that they now you don't have patients torn between 2 different groups of providers. They all are working together, all at Mon General, and I think it's just a huge advantage for patients.
So we were just talking about patients that are maybe new to the area or are newly looking for an OBGYN experience. What about the patients that are already there? How will this change their experience?
Yeah, so we've tried seeing this change. Well, I said this was a 2, maybe 3-year process. It really came together very quickly in the last couple months, probably the later months of 2018. And with that being said, we try to let our patients know as good as possible, the merger that was going to happen and the changes with that. Now, I think while we're still trying to get settled, this all happened December, so 1 month ago, and we're just trying to get our bearings in the new office and new medical record system. I think the biggest change that patients may see, and I don't want to say it's without controversy, but it's a change, and with all change, nobody likes change. I don't like change. Nobody likes change. But I think this change will definitely be for the better. Women's healthcare had always been a group practice, and the last number of years, it was a smaller group, 2, maybe 3 physicians. And when you came to women's healthcare, you saw all the providers. You saw, the 2, most recently, the 2 doctors, Dr. Craig Herring and myself, when you were pregnant, and you rotated between the 2 of us. He and I alternated call every other day, and either he or I would be there to deliver you. And the patients would know us, and they would know us very well, very well. Similarly, the group now at Mon General is still a group practice, and that's to contrast, I guess, between a solo practice. So there's very few people nowadays that do solo OBGYN.
Again, the babies never stop.
The babies never stop. And while you may say, and I think most patients honestly would find their provider that they like, and they would say, I want to see this patient or this provider every single appointment. And of course, expect that provider to be there when I deliver. And as you just said, babies deliver every single day, all hours of the day. That's essentially asking and hoping that the provider is on call 24/7. And realistically, that's not a safe thing.
No.
I mean, that's not safe. That's pretty tough. And for that reason, the majority of OBGYN providers, come together as group practices. They see that that's not a sustainable thing and maybe not the best thing for themselves or for patients, and they come together as a group practice. So that's the reason that I think that we have come together as a group practice, and there's some benefits to that. While, yes, having that continuity is good, seeing a group has some advantages.
Mm-hmm. Absolutely.
One of the advantages, I think, is that when you are seeing different providers, you always get a fresh perspective on your medical care. If you were seeing me every single day, we would get to know each other very, very well. But sometimes it might be easy for me to overlook something. You lose the tree for the forest, if you will. And if you bring somebody else in, a new doctor in, and they're looking at your case, they may ask, well, why are you on this medicine, or why are you not on this, or how about this in your history? And I think bringing that fresh perspective gives a big benefit for the patients. In addition, you get to meet a variety of patients. And again, there's many great OBGYN doctors out there, and some patients may, realize that I've got a handful of doctors, and I would love for them, any of them, to be there on the day that I deliver.
Let's pause there for a minute. We'll hit our break now, and then we'll continue this conversation on the other side.
Dr. Shane Prettyman, OBGYN and Medical Director of Mon Health Medical Center Women's Health Services, joining us in studio this morning. And Shane, you mentioned some of the physicians and providers. Well, who are they? at the Women's Health Care of Morgantown that you're bringing to Mon Health's OBGYN?
Sure. Well, we have myself that, I'm here. We're talking.
We know you're there.
We're here. I've been here in Morgantown for 8 years, did undergrad medical school here, grew up in West Virginia, went away for residency to Charlottesville, Virginia at UVA, and then I've been back here for 8 years, working at Mon General since then. And then my partner, Dr. Craig Herring, he has also been at Mon General. I should have asked him this before we started. Maybe 10 years. He was there for a year or two. It could have been a little bit longer before I was, but he joined Women's Health Care maybe 6 months before I did. So he and I have worked together for the last 6 years, kind of through thick and thin at Women's Health Care and through a whole lot of changes, and then this big transition the last few years. And he's just a great provider. I mean, he and I, again, have worked together for so long. We've done essentially all of our surgeries together. He delivered 3 of my 4 kids. There's very few physicians that I trust more than
Right.
him. So he is a great asset to Mon General, and I enjoy continuing to work with him probably for the long-term future. And then my wife is a physician assistant. She has worked with our practice for maybe 5 years, potentially a little bit longer. She did undergrad in Morgantown, and then went to Alderson Broaddus, where she did PA school. When we went to Charlottesville, she worked in a family medicine practice for 4 years, and really honed her primary care skills. When we moved back to Morgantown, she worked for WVU Urgent Care and for a couple of years, and then since then has worked with our practice in OBGYN. So she's got just a wealth of experience and background, not just OBGYN, but the urgent care aspect of things and primary care. And that's been a big asset to our practice that we've really utilized, because we have a lot of patients that we see for obstetric care, and they have other medical conditions, whether it be asthma, high blood pressure, diabetes, thyroid disorders, anything. And sometimes they don't have primary care doctors. And we as OBGYN doctors can provide some of that care, but a lot of times we're busy doing OBGYN stuff. So instead of saying, go find an OBGYN doctor, which a lot of them don't, or go find a family medicine doctor, which a lot of them don't, we're able to maintain that continuity of care. And it's just been, I think, a big benefit for the patients because they're already established with that practice. So she's coming over to Mon General along with us. And then you have Stephanie Bartlett, who is a nurse practitioner. She grew up in Morgantown.
University High School girl, I think.
Yeah, she
sure.
well known in Morgantown, great reputation, just a very, very good person. She did nursing school at WVU and then worked as a labor and delivery nurse for a number of years. That's where I first met her. And then when she decided to do nurse practitioner school through WVU, I was her mentor. I'm not sure what you would call it, but she worked with me for a year or so, and we got to work together as she learned more of women's health specialty. And I got to see really what a great person she was, what a great provider she was. She got her first job in Uniontown, but then we always had our eyes on her, and we were able to hire her back to Morgantown, and she's been with us for the last number of years. So the 4 of us are the physicians with women's health care that are coming over and now joining the Mon General family.
And it's important because it's relationship building. You guys are working with the patients and you're developing these relationships that are very, and for lack of a better word, intimate. Yeah. Not just because of the setting, but because, like you said, people come, they have conditions, they've got, and maybe even concerns. Frankly, having a baby can be really scary.
It can be, and not just having a baby, but, GYN care. You're coming to the gynecologist. Nobody likes to do it.
A lot of body changes, too.
I
all
think,
of it.
Patients say this is my least favorite day of the year,
and
very understandably. So I think the setting that we work in, we recognize the setting that we work in, and we recognize that you have to, in this specialty, have compassion. You have to truly care. You have to realize that when you're with that patient, even when you're not with that patient, that patients come first. You have to listen to them. You have to slow down. You have to take your time. And when you do that, patients absolutely recognize that. And I think they realize that this person really cares. And when you do that, again, I think that benefits the patient and the provider, because you get to really, you break down that relationship, if you will. You break down the barriers, and you really kind of get to, more of an intimate level, and then you just get better medical care because of that.
Let's remind everybody, because as we were talking about changes, I did want to mention there is going to be a new office location, obviously. So let's just tell everybody very quickly here where that will be. And I think, yeah.
The address, numbers. So several years ago, Mon General built 3 new office buildings right off. You can see it off of 705 as you're driving down. The exact address is, Mon Health Medical Park. There's a 1,000 building where Wedgwood Family Practice is, a 2,000 building where we are located. It's on the first floor. The second floor of that building is the outpatient surgery center, and then there's a third building further in the back. So the 3 huge buildings, you can't miss them as you're coming down 705.
Good. So if I'm big and pregnant, I don't have to go up the stairs.
Absolutely.
That's what I want to hear.
It's extremely accessible. You pull in, you're right there. It's very, very easy to find.
All right. We are speaking with Dr. Shane Prettyman. We'll continue this on the other side of the break here.
Talking to Dr. Shane Prettyman, OBGYN and Medical Director of Mon Health Medical Center Women's Health Services.
And Shane, we only have a couple minutes left, but I want to just revisit the fact that we've got this merger going on now, and you have chosen Mon Health. Why have you chosen Mon Health?
Well, again, Women's Health Care of Morgantown has always been associated with Mon General Hospital. And when we came to this fork in the roads as far as being affiliated, or I guess being managed and owned by a hospital, I mean, you have 2 hospital systems here, and ultimately just knew that we were very happy with Mon General Hospital. Mon General Hospital's reputation, giving personable, really a private community feel, just wonderful patient care, we recognize. Also, the birth center at Mon General, the nurses, just wonderful staff. The personal experience I've had there, both as a physician and having 3 of our children there, are wonderful. And then in addition with a lot of the administration changes at Mon General, I mean, we were making this decision through that, and while it could have been easy for that to veer us away, it actually probably recommitted our commitment with Mon General, especially with David Goldberg and the newer administration that he brought along. I mean, just seeing their passion for community medicine, seeing the experience that he had up at Allegheny General, correct? And hearing their vision, just to continue that vision that Mon General has always had as just the premier community hospital. We knew that under his leadership, Mon General would continue to do great things, and it made us excited. And that's why we were just, passionate about staying with Mon General and just continuing what we've always had.
Well, for folks that are listening and want to reach out, monhealth.com/OBGYN. And again, thank you, Shane, for coming on. Dr. Shane Prettyman, OBGYN and Medical Director of Mon Health Medical Center Women's Health Services.